My name is Helene. I'm very excited to be hosting this webinar today. And as you can see, I'm incredibly lucky to be joined by two amazing guests. So we have Dr. Yulia Kovalenko, so lucky to have so much experience from the clinical world, but also a life outside of medicine, reminding us that we are also human. Thank you so much, Dr. Yulia. Will you just wave a hello to everyone so that we can see you as well?
Hi, it's very nice to meet everyone. Thank you guys for joining. I really appreciate you inviting me to this webinar today. I'm excited to share my experience with you and answer all the questions you might have.
And we're really excited to hear all about that. We also have another esteemed guest joining us today, Dr. Zain Abdeen. Dr. Zain is also the founder of IMG Helping Hands and currently the director of the American Research. Will you continue your introduction for me, please?
Yeah, so I'm director of American Academy of Research and Academics. Currently, I'm completing my PGY3, planning to move to New York once I'm done with my residency. So we're going to keep doing our ventures, assisting people from other states or from other countries who are transitioning to the American healthcare system. Yeah, I'm happy to be here and answer your questions.
And I'm really happy to have both of you here. So honestly, just to start, Dr. Yulia, I did a little bit of stalking and I found your social media page. I also found your Instagram and I found the recent post that went viral and it was about doctors are more human. I was really wondering what was going through your mind that day? You know, what inspired you to do that? I was just really impressed.
Thank you so much. So I'll provide a little bit of my background and then answer your question. That idea did not come up to my mind immediately. So basically, for those who didn't see my post or don't follow me on Instagram, I've recently posted pictures with the board that was saying you're more than medicine. Medicine is not everything. Basically, advocating for physician lifestyle and prioritizing lifestyle as opposed to career focused kind of a approach. I was thinking about that for a while, and I think my entire journey inspired me to prioritize things outside of medicine more. So I did my medical school back in Russia, and then I studied USMLE, conferred my diploma here, got ACFMG certified, went straight to residency. I did my internal medicine residency at UPMC Harrisburg. And then when I was about to go into fellowship, and off note, I've done a lot of research in HEMONC and I wanted to join fellowship. But during my away elective, I met a lot of people who I felt were focused on medicine alone without anything happening outside of their careers, people who are involved in clinical trials, sacrificing their entire life to medicine. And I just realized that I'm not ready for that. So I decided to go a different route. I decided to get my green card first because I came to the US on a J1 visa. So I decided to take care of that while figuring out what I want in the future. And once I started to work as an internal medicine faculty, and I work at Eastern Virginia Medical School right now, I just realized that life is so much more than medicine. I used to do so many things before I joined medical school and started my USMLE journey. And when I, started my residency, started thinking about fellowship, got wrapped up in a lot of research, it started to seem like there is nothing outside of medicine for me, and that didn't feel right. So at some point, I just realized that we need to emphasize the importance of maintaining, your hobbies, your life outside of medicine. Otherwise, that's gonna immediately lead you to the burnout, which I think I experienced during my third year of residency. I'm happy to share more details depending on what you guys are interested in.
I think we're happy to hear. We really would like to get to know you as well as everything you have to share. So please go on.
All right. So basically, like I said, when I joined U.S. medical residency, I don't think I was prepared to, to the lifestyle of doctors here. The working hours were just insane. We worked up to 70, sometimes 80 hours a week, and it seemed like there is nothing outside of medicine there. I feel like medicine is also full of very competitive people who just want to be the best everywhere. And I think my residency class was very competitive as well. Everyone wanted to go into some competitive fellowship. Everyone was involved into research. And so I felt like we were overwhelmed and burnt out by everything that we planned for ourselves. And I think the turning point for me was when I went to MD Anderson for a way elective. And for those who are not aware, MD Anderson is one of the best cancer centers in the world. I think it's always competing with Sloan Kettering Center. So I went there for leukemia, away elective, and there were some people. There was this guy who, just got a brain surgery, and immediately after, 1 week after his surgery, he was back to his fellowship. And when I looked at that, I just realized that we're probably sacrificing way too much there and putting aside everything, all of our life, our families, our health, prioritizing things that might not be that important long term. So I do not regret my choice of becoming internal medicine faculty, and my lifestyle is great so far. And while I'm not completely decided on whether I want to do fellowship later on or whether I want to continue internal medicine academic route. I think that it's very important to stop and reconsider your life choices before residency, during residency, and during your fellowship. Just making sure that your goals align with whatever you feel like you want to happen in the next 5 years. Because what I feel is happening to a lot of people, they find themselves being burned out in several years of their attendinghood, and then they just don't know how to come out of this burnout. I feel like a lot of physicians are focused on early retirement, especially those who sacrifice the majority of their years to their career. Some of them do not start their attendinghood until their mid 30s, and by that time they're just so tired and burned out that sometimes, again, people are just focused on making as much money as they can and then retire in the next 5 years, as opposed to making it a marathon rather than sprint, and just making sure you can pause and stop and reevaluate your goals and your life priorities. And so that can be that's a lifelong journey, right? Medicine is not going anywhere. You can always do your fellowship later on. You can always do your research later on. But some things in life, I feel like they're time sensitive, such as relationship with people, your health, your mental health, your family, kids. And if you just put everything aside, you're just going to be wrapped up in this career, journey all the time without having any break. So that's how I felt, and that's what inspired me to just create more content on lifestyle and just showing that physicians are so much more than their career path, than their just MD, PhD, and everything that follows their name under the email. And I feel like that has been reciprocated by so many people across the country that I'm very satisfied. I'm very happy that I get such a great feedback from this post. I think there's some question or someone messaging in the chat, or no?
Yeah. I'll have a look at the chat. So
Okay.
anyone, if you have any questions, you just feel free to pop it in the chat, and then I will try to look at it, and then by the end as well, I'll go through them. So if it's okay, we'll let the chat go on, and then towards the end, I'll just ask the questions as well, so we can just have a bit more of a chat. But thank you again for saying that. Yeah, I think a lot of people really do struggle with wanting to be perfectionists, especially in the world of medicine, because it's the way you're sort of going through it. You have to get straight A's, you have to do amazing, you have to get into the next internship, you have to get into the next fellowship. Do you think for people who are burnt out right now, or someone who's struggling, what would you tell them to do? What sort of advice would you be like, this is what you can do to find yourself again? What do you think helped you find yourself again?
Yeah, that's a great question. I would say that, realizing and validating your burnout is actually the most important step of your journey towards yourself. So I think I realized that by the end of my second year of residency, because our journey really started way before residency, right? We started with our medical school, with USMLE exams. For those who are international medical graduates, you got to keep up with everyone else, learn the system. And I feel like sometimes burnout can be masked by procrastination, laziness, depression, you name it, and just this honest talk with yourself is very important. I would say that it's so different for everyone. And I want to say that there are some people who genuinely want to do medicine and want to sacrifice everything to medicine because that's something that makes them happy. And I'm very, I admire people like that who can genuinely love medicine to the point where they're just getting absorbed by it and they don't need anything else to decompress. But if you feel that you're sad or depressed, definitely talking to therapists help to just discover everything about yourself and just having this honest conversation with yourself, with your friends, with your family, and realize what are the roots of this burnout. Is it because you are just doing too much and you kind of need to slow down a little bit in terms of how much research you do or how many administrative duties you have? Or whether you want to reconsider your career path, meaning maybe you don't want to do this fellowship anymore that you decided upon 3 years ago when it was the time to find your mentor or something like that. Or maybe you just want to do something outside of medicine to, again, find the way to yourself prior to all of this journey. Because like I said, I used to do so many things, and then, every time you are sacrificing small things, and by the end of the day, it seems like you have nothing besides medicine and just doesn't feel right. So I want to say that it takes time for you to have this conversation with yourself and asking yourself, where do I see myself in 5 years? Do I want to be married? Do I want to have family? Or is fellowship and being like GI attending is the only thing I want, and that's going to make me happy regardless of what's going to be going on outside of the hospital? So those are important questions you want to ask. And if you feel like something that you do right now does not align with this long-term goal, you can just make those small changes to see how that's going to improve your your feelings and the way you feel about your life in general. Working with a therapist definitely helps. Just thinking about which hobbies can you introduce to your life. It's very important. I think for people who tend to be hyperachievers, it's very hard to put everything aside and just spend time doing nothing, spend time with your friends and family. Because if you're used to being productive all the time, and we know that productivity is actually one of the forms of addiction, because it's very rewarded in the society. Everyone is like, you're doing so well, you're so hardworking, you achieved so much. But by the end of the day, if you are sitting at home crying overnight, that doesn't make any difference. So I think that's how I felt by the end of my second year of residency. What? I think I've heard something.
Yes,
Never mind. Okay.
I'm currently a PGY3, so I kind of have the same feeling right now what you had by the end of the second year.
Yeah, because I was presenting at ASCO conference, I was presenting at ASH conference, I went to MD Anderson and Harvard to my away electives, I met with program directors, I made so much research, probably more than anyone else in my program, because I'm like a great example of overachiever. However, I couldn't help but I just realized that I just don't feel like myself anymore. And for some reason, although from the outside everything looks so polished, I'm not satisfied enough. I was just standing on this ASH or ASCO conference looking at the people who surround me, and they seemed genuinely happy to be there, interested and absorbed in all of this research. But I didn't feel that way, because I realized that probably for me, although I know I can achieve everything, I can't do it. It's like on the tip of my fingers right now. I feel like maybe that's not something that I want right now. Maybe because, I didn't see my family for 3 years. I didn't see my friends for a long time. And that's been, anyone on a visa could probably relate. I don't do things that I used to do. Maybe I want to go back on social media, but I can't. And that's the other thing, that while you're in residency, it can be really hard to remain active on social media, because there is this social pressure. Look, you're not doing well enough on your clinical rotations, and yet you're posting stuff on Instagram. So I couldn't do that either. You know what I mean? So I just felt like I'm putting myself in a prison of my own overachievements. And so can you hear me? Okay.
Yes.
When I came back from my away elective from MD Anderson, I think that was a turning point for me to realize that I need to have this conversation with myself. And I did. And that was the time when I decided, okay, I'm just going to put the fellowship plan aside for the time being, and I can do it whenever. I was 28 at that time, and I felt like, even if I was older than that, I felt like fellowship is not something that is time sensitive. Again, you can do all of your research, you can get all of your letters, all of your clinical rotations at the age of 50 if you want to. But some things, your health, your hobbies, your time with the friends and family, you're never going to get it back. Right. So that's something that I realized. And honestly, it's been a year of attending hood. It's for me. And there wasn't a single day when I regretted my decision. I think I felt a little jealous on the fellowship match day on my third year and even on my first attending year, just because it kind of feels that, okay, I could have done it, but I didn't. And you have this FOMO that you didn't go that route, and everyone is like posting these fancy fellowship matches on their Instagram. But that day passes. And by the end of the day, no one cares about your achievements as much as you do. I think that's the most important thing to realize. You're not living your life for everyone else to validate you and your achievements and your personality. You're living this life to enjoy it yourself. I think in medicine, we are so used to just validating our meaningfulness through other people, because we don't have too much of a dopamine. I feel like sometimes we're just studying all the time, we're working on the time, and that's such a great way to get dopamine, get approved on social media for matching into Harvard or something along those lines, right? But again, by the end of the day, it's you and your life decisions, sitting in the evening with yourself and just thinking, am I happy at this moment? I think that's very important to realize. And honestly, back then it felt like was a downshifting for me not to go for fellowship. When I was advertising, research, and fellowship to all of my fellow residents throughout these 2 years, I think that's a strength to realize that maybe I need to just pivot and think about what I want, what makes me happy. And if you have an opportunity and if you have the desire, I mean, I'm not telling that everyone has to become an internal medicine attending. Maybe you hate internal medicine, but if you feel dissatisfied with whatever is going on, that's how I felt, then probably what I'm saying is going to make a lot of sense to you. So
Yeah, no, that was really great. I think it's important that everyone really look at themselves and sort of, are they happy with where their life's going, what sort of decisions they're making, and where that's taking them. So I think that's really important, and thank you for that advice that you've just shared. Now, I know you mentioned internal medicine, and a lot of people here are really interested in internal medicine and considering it. So could you give us sort of a day in the life of an internal medicine or internist? What does it look like? What sort of do you do?
yeah, that's a great question. I think internal medicine is so diverse. You can choose whatever lifestyle is good for you, because there are several options that you can do after finishing internal medicine residency. So you can become a primary care provider if working business hours from Monday to Friday is something that you want, and then you're going to have about 4 to 8 weeks of vacation a year typically. And then you can become a hospitalist, which are typically paid more compared to academic medicine, like a faculty positions. And they tend to work half of the year, and their schedule is typically 7 on, 7 off, or sometimes 14 on, 14 on off. It's very flexible, and you're kind of doing everything on your own. Or you can be internal medicine faculty, which I decided to do, because for me, again, although I wanted to prioritize lifestyle, I still wanted to stay within the academic circle, so I don't so I can still go into fellowship later on if I decide to, because that's considered better for your resume. But I think as long as you stay active in research, it doesn't really matter whether you're a hospitalist or PCP or internal medicine faculty. As long as you can prove your connection to your specialty, that's probably going to be fine. So I'm going to talk about my typical day in life. I work as an internal medicine faculty, and I'm faculty full time, so I don't really have patients on my own often. I only work with residents. So I wake up at 6 because I like to start my morning early, and I feel like it's the most efficient way for me to manage patients and get ready for rounds. And again, I'm a junior faculty, so I don't know everything. So I want to get prepared for my round. So I wake up at 6 and then I do my chart review from home because I don't have to physically be there. If you're a hospitalist, you probably have to be in the hospital by around 7 a.m. For me, it's residents who are managing acute conditions, rapid responses, and I'm just kind of supervising them, and I'm available on phone since 7 a.m. So I do my chart review, and then I typically come to the hospital at around 8 to 9 a.m., depending on my morning. If I come a little earlier, I can see a couple of patients on my own, and then I start rounds with my residents. I used to love table rounds as a resident because I feel like everyone is more focused, everyone has computer in front of them. So that's what I do with my residents. I do table rounds and I teach them. Whenever we have some educational points, I would just bring them up. I also have, my team is typically consistent of couple of residents, couple of interns, one resident, couple of interns, and a couple of students as well. So we do some teaching sessions, we discuss topics together, and then we typically see a couple of patients together, new one or interesting ones, just so they can learn a little bit of bedside manner. But some of the days I just do table rounds alone. And then after that, I'm pretty much done after I saw all the patients. So after rounds, I typically see my patients, and the time that I can leave the hospital depending on how fast I see the patient. So that could be anywhere from like 12 p.m. to 1 p.m. Sometimes Mondays take longer once you get to know your team. After that, I finish my notes from home if I didn't type them while residents were presenting. And I'm just available on the phone until 7 p.m. There are a couple of days a week that we're on call, so I have to remain available overnight. I never had to come to the hospital, and that there's not much that I can offer overnight because there's critical care team that is available 24/7. So they will be managing all the acute conditions, and residents can just call me if they're unsure about some critical decisions in terms of management. So honestly, the main downside of my job is the salary because it's much lower compared to hospitalist salary. The rest of it is just great. The lifestyle is great. I find myself enjoying residents' company more than patients' company, but that's just how I am. Some people love to talk to patients for ages. I'm like an educator rather than clinicist, I feel like, just based on my personality. That was one of the reasons why I wanted to do HEMONC, because I feel like it's very theoretical specialty and does not require too much of a I want to say procedural component besides bone marrow biopsies. So I just enjoy teaching a lot. And for those who are who also want to consider educator academic path, I think that's a great opportunity. So I just love my job, and EVMS here is the best place to work at. I'm not advertising it, but I just love it, and my leadership is great. And I just want to tell you a story that kind of emphasizes on how important it is to find the right place to work in. So basically, it's related to social media, and I had a meeting with one of my leadership, and he's my research mentor as well, because I'm hired as research faculty. So I work only half of the year, which is very uncommon for faculty. I have a lot of protected time to do research with my residents. So I had this meeting with my research mentor, and I think he's around 60 years, maybe 50 something years of age. And he goes like, oh, I've seen your TikTok videos. And my cheeks just turned red. I'm like, which TikTok videos? And that was the video that I made with like scrubs flying on me and like everything. It's like such a stupid video, one of the most silly ones among those that I posted. And he's like, this is great, you should continue, you should like advertise our institution. And then in the end of the day, he sent me digital media fellowship that is available by Journal of Hospital Medicine. He's like, you should apply to that one because that's going to align with your career goals. So I did, and I actually joined this fellowship this year. So I'm going to be doing this digital media fellowship, which is focused on like social media and digital content creation. So I think it's very important to surround yourself with people who are going to who are going to encourage your growth, both career-wise, life-wise, and they're not going to like make you do things that does not align with your future goals. And I feel like that's how I feel in this environment. I feel like I'm thriving, and I would say that choose your job carefully. Try to go on site if possible. Talk to people who work there, because I would say your leadership and the climate in your hospital and among your colleagues is going to be very important for your future. But that's been my experience.
No, I was going to say congratulations on the new digital media fellowship.
Thank
You
you.
look really, really happy about it. So we're really glad that you're living the life of your dreams. Also, there was just a question in the chat. A person was saying, as an attending, what are the main questions you look for in a resident that you're working with? Yeah. Are there any specific qualities that you look for, you think that sets them apart, that makes a resident really good at what they do?
I would say that transparency and honesty is something that I value the most. I never appreciate residents lying about things or mentioning things they're unsure about. So I want to say that being transparent about your weaknesses, if you didn't see the patient or you don't know their creatinine from the morning, do not make it up, because attendings never forget. I want to say I'm very forgiving in terms of, some knowledge gaps, because I can relate. I was just a resident a year ago, so I'm never tough on my residents or students. I never want their cortisol to go up, because that's gonna obscure their learning curve. I want everyone to be relaxed and enjoy rounds. However, I want everyone to be honest and transparent. So I would say that's number one. Number two, medicine is a team sport, so I love to observe residents who respect each other, who are helping each other. It's the beginning of the year, so interns are fresh, and first years just became second years, so they got to manage the team on their own. And I want to say that whenever people are trying to point out on whatever the other person didn't do, it just doesn't look good. So I want to say that people who are good team players, who can support each other, try to cover for each other weaknesses, that's very important. That's something that I value a lot. And number three, curiosity. I understand that everyone is like tired and burned out, but I appreciate when residents and interns are curious about their patients, that they're not completely indifferent of what's going on. They're trying to dig into more clinical, ask more clinical questions, dig into the chart, maybe something I didn't even think about. That's something that is really appreciated. And the rest of things, honestly, knowledge and clinical skills, they're gonna just enlarge as the time goes, and they're gonna improve. I just want to say, as long as everyone is staying curious and trying to improve based on their feedback, those residents will thrive for sure.
Okay, thank you so much for that answer. So just for you, just as you said, so the transparency, honesty, lifting each other up, teamwork, and also being curious and wanting to learn about everyone. I think those are interesting qualities. I didn't expect them. I thought you would say, I don't know, running around everywhere or doing a bazillion things at once, but I think that's very important as well, the qualities that you mentioned. I want to ask you, actually, you and Dr. Zain, a question. We're gonna switch it up a little bit. There's a lot of IMGs here, and there's also a lot of uncertainty in today's administration. So I was wondering, both of you, what do you think are some of the challenges that IMGs might face regarding this new uncertainty or in the application process? Is something, both of you, please, just, I was wanting to take your perspectives on that.
I can start. I mean, oh, sorry. Do you want to go ahead?
No, you can start, doctor.
No, I just wanted to share the challenge that I've personally experienced even before the administration change. I came into the US on a J1 visa, which just gets expired sort of every year. So you got to renew the stamp every time you come outside of the US. And that was one of the things that was very inconvenient for me, because you got to, plan your holidays, your weekends around the plans to get this visa stamp and then come back to the US. So that was the reason why I couldn't see my family family and friends for a while. So I just want to say that, you know, the process of getting green card is only getting harder and harder. And it seems like because of all of this immigration changes, the waiting time is just getting increased. So I feel like it's very important for IMGs to feel that they are valued in this country and they're welcomed, and there is no problem with like scheduling visa appointment, crossing the border. But as of now, it seems like it's been an issue in the recent past and people couldn't travel much. I honestly just went back to Russia, and that's not the most friendly country right now based on the political situation. However, I felt like if they don't let me in this country back, I'm just gonna go somewhere else. I want to say that it's important to finish your residency if you don't want to risk like crossing the border or not getting your visa approved. But after that, I feel like, you know, it's also important to prioritize your family and friends and just go visit them regardless of the immigration situation. But that's of course dependent on your situation. If you don't really see yourself anywhere else outside of the US, then probably it's better to wait until the green card. But that's been something that has affected my quality of life a lot.